Next speaker is Kezia Gaitskell.
Hello, I'm Kezia, and I'm a pathologist and epidemiologist in Oxford. And so for the next 10 minutes, I'm going to be talking about trying to integrate digital histopathology slides to better phenotype cancer outcomes in UK Biobank. So I'm going to start with an introduction to histopathology, explaining why it's important for clinical practice and for cancer research. I'll then outline the existing histopathology data in UK Biobank and talk about our future plans and a pilot study that we're starting to try and enhance the histopathology data in UK Biobank. Now, I'm going to start with a crash course in histopathology. So this is for the non-medics in the audience, and I apologise to those for whom this is insultingly basic. But histopathology is a laboratory medicine specialty where we look down microscopes at slides of human tissue to diagnose disease, particularly cancer. So we start out with a small sample of tissue. This might be a biopsy, just a few millimetres in size from a larger tumour that someone is worried about, or it might be a known cancer with surrounding tissue, which we then dissect in the laboratory to get smaller pieces of tissue. These pieces of tissue go into plastic cassettes after being fixed in formalin. The plastic cassettes then go into big machines that have lots of different chemicals in, which change the water content of the tissue, so that we can then embed it in a wax block. We then cut sections of these wax blocks, a few microns in thickness, and put those onto a glass slide. We stain the glass slide with pink and purple dyes called hematoxylin and eosin, and then a pathologist like me will look at these glass slides and write a report. So if we've only got a small biopsy, we might have one slide, and we might give fairly basic information, like confirming, yes, it's a cancer, perhaps saying what kind of histopathological type of cancer it is. We might be able to give a grade, a measure of how ugly the tumour is, and we might be able to give some molecular information. If it's a big cancer resection, we may have lots of slides, and we may be able to give more information, like how big is the cancer, how far is it from the resection margins, and how far is it spread into the surrounding tissues or into lymph nodes, the stage of the tumour. And all of this information is really important clinically because it helps to govern what further treatment the patient needs, and it informs prognosis. So, one of the things I mentioned that we look at down the microscope is the histological type of the cancer. So as most people in this audience will know, cancers at a single site, like the colon or the ovary, are not all the same. You can divide them into different types based on the morphology, what it looks like down the microscope, and on molecular changes. And these will often have different etiology, different treatment, and different prognosis. And so that's why it's important to be able to type the cancers. And on the right here, we can just see some examples of different histological types of ovarian cancer, which look different down the microscope, have different molecular changes, different behaviours. And so, unsurprisingly, if we're doing epidemiology of cancer research, it's important to take account of these biological differences as well. So just to give an example of some cancer epidemiology work we did previously in the Million Women study cohort, looking at ovarian cancer, on the left, we can see examples of looking at the association between known risk factors for ovarian cancer, such as tubal ligation, which vary very substantially between the histological types of ovarian cancer. And on the right, we can see survival, which again varies very substantially between histological types. And the same is going to be true of lots of other cancers and has been replicated in other cohorts. So that's why it's important to take account of pathology. So, as has already been mentioned, the existing data that we have in UK Biobank comes from linkage to routine cancer registry data. And so we have information on the cancer site, so the colon or the ovary or other sites coded by ICD-10. And we have information on the tumour morphology, the histological types, which is coded in ICD-03. Again, as Naomi has mentioned, we're planning to link in the future to more detailed national cancer data. And so this will give us information on things like the tumour grade, how ugly the tumour is, the stage at diagnosis, how far the tumour has spread into surrounding tissues, and also some information about specific types of spread, so involvement of lymph nodes, for example. However, what we're really excited about is a pilot study that we've started to look at trying to integrate the digital histopathology slides. So we're starting initially with UK Biobank participants with colorectal cancer biopsies in Oxford and Leeds, and we're scanning the glass slides to make digital whole slide images. As part of this, we're also retrieving the original pathology reports to get some core information that isn't in the national data. The main point of this study initially is just to look at feasibility, the availability of the slides, the logistics of retrieving them, the cost and the added value to UK Biobank of these different types of data. We're also going to try to generate derived metrics related to tumour pathology to better classify the cancer subtypes, and I'll talk more about that in a moment. Ultimately, the aim is to scale this up to look at other cancer sites, so other types of cancer, but also other geographical sites. So just for anyone who hasn't seen a histopathology slide before, this is what they look like. And so this is from some earlier work we did looking at ovarian cancer in the Million Women study. And so on the left, we've got a large low-power view of a whole slide image of an ovary that has been infiltrated by cancer. And then on the right-hand side, we can see a close-up just to show that these slides are scanned at 200 to 400 times magnification. So you've got some really high-resolution images there. Now, I also mentioned the potential to derive further molecular information. So this is just showing some work that was done by the ESCORT consortium, where they were looking at the consensus molecular subtypes of colorectal cancer. So they worked across data from multiple cohorts of colorectal cancer patients, and they were able to derive an image-based molecular classification to replicate the true molecular data. So looking at these graphs, you may think, gosh, they look almost identical. And that's really encouraging, because the left is the survival curve of the actual molecular subtypes of the colorectal cancers. And on the right, we have the overall survival of the colorectal cancers in the versions of the molecular classification as predicted just by running an algorithm on the digital pathology slides. So this is just illustrating how the digital pathology slides can really help us to derive molecular classifications, even on cases where we don't have the true molecular data. And so one of the things we're going to try in our pilot study is to apply algorithms like this to the scanned digital slides of the colorectal cancer biopsies in UK Biobank to see if we can generate these kinds of inferred molecular classifications. So I hope I've shown you some of the potential value of these kinds of large-scale pathology data in UK Biobank, that it will allow us to do better analyses of risk factors and survival that take account of these meaningful differences in cancer phenotypes, that we can apply image classifiers developed in other cohorts to these digital images. But I think the really exciting thing going forward for researchers is the potential to develop novel image analysis algorithms using artificial intelligence, machine learning, and other techniques by linking these digital images to the existing rich data that we have in UK Biobank. Things like questionnaire data, genetics, blood biomarkers, clinical data, all the other things you've been hearing about today. And so I think that's a really exciting potential development. I should say this is a very early stage of the pilot study, so we're still trying to work out the best way of doing all of this. So if you're involved in the area and have suggestions about things we should be doing, please do get in touch. Finally, I should acknowledge that obviously this is a hugely collaborative endeavour. So first acknowledgement, as always, to the UK Biobank participants, but also great thanks to our collaborators from UK Biobank, the team in Leeds and the team in Oxford, who are helping us to start this pilot study. Thank you very much.